All right, now this will be the second piece in terms of treating the hip, because obviously we're going to be loading the adductor muscles as we take the hip through when we're kicking. Remember, we've got the hip into external rotation, kicking through the ball. So we've already done some treatment to those external rotators. It is absolutely imperative that you clear out these adductors. Every soccer player should be having these adductors work. It's just so important and often missed. So there's a couple of ways of doing it here with Bianca. I've obviously just put the leg into a little bit of hip flexion. Obviously we've bent the knee up, and then we've brought the leg up into a little bit of adduction as well. And that means that we can actually work through here. So as you know, in the hip protocol, I talk about releasing the adductor magnus, and that is absolutely important. There's no doubt about it, because it can inhibit the glute medius. But today we're going to look and focus on the adductor longus, because that's probably the number one muscle that gets strained in terms of adductor injuries for soccer players. So it absolutely has to be in your treatment recipes. All right, so once again, it's a really broad approach first, because it is important that we don't dig into these muscles, because your clients or your athletes will just start to basically spasm and then they'll guard. So really need to make it quite broad. So what I tend to use is almost a bit of an L shape, if you like. So we're going to place that over here. I'm going to brace with my other hand over the top here, which means that I can pick up all this tissue coming along and down here without having to dig into any of the tissue as well. So that way it makes it just that little bit more comfortable. So as we know, there is a trigger point in that adductor longus, which is in the midpoint here. We can definitely look and locate that and work through those trigger point sites, but to be honest, it's all about just getting a really good broad approach to that adductor longus, just to deal with that load issue, as I mentioned before, from kicking. You know, when we start talking about using these techniques for performance therapy, we're looking at trying to make our athletes work better. So we're not actually dealing with the injuries. We actually want them to kick so much better, and not only kick, but obviously take the ball, turn, and then obviously kick as well. So it's all about that agility as well. So dealing with these load issues for the major muscles that obviously get loaded from the actions that they do, absolutely important in terms of making sure that you're taking care of your athletes the right way.